What the facts are over and over again. We understand the fear. This virus is not spread by anything other than direct contact.
A Dallas nurse who treated a sick man from Liberia was just released from the hospital this afternoon. She's only one of 2 people to get Ebola here in the U.S. The other was also a nurse who also treated that same patient, and she's already been cleared too. A different nurse who fought officials in New Jersey about her mandatory isolation is now back home in Maine, and she doesn't have any symptoms. There's one person currently getting treatment in America, and that's the doctor in New York. Tonight, 9 states and the Army have now boosted their own rules and quarantines above and beyond the federal guidelines issued by the U.S. government.
But all of this is happening at the same time we're getting new guidelines issued by the CDC.
They're pushing to get rid of the word quarantine for anybody coming back from West Africa. Instead, officials are calling for active monitoring, combined with travel restrictions and limited exposure to the public, to decide on whether or not their movements should be restricted. And that would only apply to people at the highest risk of getting the disease. This afternoon, ABC 17's Ashley Strohmeyer spoke to Boone County health officials about the evolving changes the CDC is implementing. Ashley?
Dana, the Boone County Health Department tells me the CDC's changing Ebola recommendations are actually normal, and they refer to them as situational changes.
The important thing to remember is that public health is used to dealing with ever-changing environments and adapting to this information. It's just part of the daily life.
Weiner compares the situational changes regarding Ebola to the H1N1 disease a few years ago. She says when they first heard about it, they were constantly receiving information and updates from the CDC. And the same goes for Ebola.
Situational changes, I guess, is what you would call it.
The new CDC guidelines out today specify people who are high risk or people who have had direct contact with Ebola but show no symptoms will not have to stay at home. The CDC recommends high-risk people do not go to places like shopping malls or movie theaters. Linnell Phillips is a nursing instructor at MU. She says the new CDC recommendations are more of a fear-based policy than factual policy and doesn't agree with forcing someone to be quarantined for 21 days without showing symptoms of Ebola.
You're taking away their personal freedom for 3 weeks. I mean, that's pretty harsh.
Phillips tells me the emotional toll of taking care of someone with Ebola is stressful enough on someone.
If you're going to take away someone's freedom, you better be clear on why that is and that it's very necessary.
Phillips stressed the importance of fact-based protocol and not fear-based protocol. She says even someone who has traveled from an Ebola-stricken country should not be quarantined until they show the first symptoms.
Ashley, thank you. The CDC bases the recommendations on information that most patients in Africa who came in contact with Ebola typically get symptoms within 2 weeks of contact.